My name is Chris Pennington. I'm a faculty member at Ivy Tech Community College in Sellersburg, Indiana. At Ivy Tech, we are fortunate to be implementing a simulation program in our nursing department and are in the process of building a state-of-the-art simulation lab. Simulation allows the students to role play as a nurse in a real clinical situation without harming a live patient. Prior to SimLab, students are going to be given a diagnosis, medications, and an SBAR physician reference sheet to become familiar with. Then once students come to SimLab, they are going to be assigned roles as the nurse, family member, or the observer. Assessment is one of the most important things for a nursing student to become proficient at. Assessments help them to get a baseline for how their patients are doing and to discover if their patients are in distress. To complete a full head-to-toe assessment, the nurse will literally start at the patient's head and assess everything down to their toes. This will include the neurological system, cardiovascular, respiratory, skin, and GI. Vital signs should always be included in a full head-to-toe assessment. This will include blood pressure monitoring, temperature, heart rate, respiratory rate, and pulse oximetry, which measures the level of oxygen in the patient's blood. In a full assessment, a nurse should assess anterior and posterior lung sounds, meaning listening to the patient's front and to the back, and identify by name any abnormal sounds that they hear. It is important to use therapeutic communication with both the patient and their family. This reassures the patient and can comfort them while building a trusting relationship. Good communication can also help the nurse to notice subtle changes in the patient's condition. Recognizing signs and symptoms of distress is important when caring for a patient. A nurse should always be quick to respond to a patient in distress. Contacting the physician in a timely manner is essential when a patient is in distress. This should be accomplished in about 5 to 10 minutes. Accurate and recent assessment is necessary so the physician can give appropriate orders for the patient's condition. A tool called SBAR, which stands for Situation, Background, Assessment, and Recommendation, has been developed to ensure all the needed information is collected before calling the physician. After obtaining orders from a physician, it is important to carry out the orders in a timely manner. This should be accomplished in about 5 to 10 minutes after getting off the phone with the physician. The nurse is responsible for notifying any other departments if there are exams needed for the patient. Orders should be carried out in the order of importance. For example, if it's a patient in respiratory distress, then oxygen should be a high priority, and that should be started before other orders are carried out. New medication orders should be administered as soon as they are available from the pharmacy. A nurse should always be aware of the action, side effects, dosage, and the route of the medications that they are going to administer. Prior to administering any medications to a patient, the nurse needs to check the patient's name, date of birth, and allergies. The nurse is responsible to explain any test or procedures that are ordered for the patient. They should explain this to the patient and to their family if they are present. If the nurse is unsure of what the procedure or the exam is, they should utilize their resources to learn more about the procedure or exam that is ordered for the patient, or contact the department in which that procedure will be performed so that they can give the patient the necessary information. There are always resources available for nurses. This can range from charge nurses, pharmacists, lab technicians, physicians, online medical resources, and other departments within the facility they work. A nurse should never feel they are alone in an unsure situation. Always reassess the patient, especially after any new orders are carried out or if the patient is in distress. Things can change very quickly with a patient. After the simulation experience, the student nurses and the instructor will debrief or reflect on the simulation. We will discuss strengths and areas for improvement. The observers and family members will participate in the debriefing and be able to offer feedback that they noticed during the simulation. Simulation offers students opportunities they may not receive in a regular clinical experience. It helps to develop critical thinking skills that are necessary to be a successful nurse. We are excited at Ivy Tech Community College of Southern Indiana that we will have a state-of-the-art simulation center to enhance the education experience of our nursing students.